Hello everyone, my name is Veriana Parra, and the main topic to talk about is what are the food policies that right now are on Latin America. So we're going to make a review of the latest strategies applied in Latin America to fight against child obesity and to improve the health environment around children. Let's begin with Mexico. In 2014, the country established the food taxation on sugar, sweetened beverage, and non-essential energy-dense food. They had the main objective to reduce the consumption in the young population and generate education around children and parents. After the implementation of these policies, some results showed that the reduction of the consumption of those foods and beverage by 11%, but more strategies were needed. So in the same year, a science-based mass media campaign was launched everywhere with high credibility and helped to reduce the tax's opponent. More people understood the significance and the relevance of these policies for their health and the health of the children. Other strategies we can mention are the new labeling in products, indicating the risk of the consumption of certain products and its contents, and also some states, such as Oaxaca, prohibit the sales of junk food and ultra-processed food to children in schools and in local stores. So in the case of Mexico and the new labeling and the new policies applied in the food consumption, we can see that these are some good strategies, and we can see the benefit of this strategy in the next year. The labeling strategies were also applied in other countries. We can mention Chile. More people need to understand the labeling in order to make better choices in which products they consume daily. And for that reason, in 2014, the National Senate of Chile implemented a label policy to improve a guidance of the ingredients and how to define an unhealthy food. But was until 2016 that the National Law of Labeling and Nutrition began, all by negotiation of all parts: food industry, consumers, experts, and governments. This all just to make sure that the people understand why it's important to know how to interpret the information that are contained in the food labeling and what are those ingredients and those components that it's better not to consume to keep the healthy lifestyles and to prevent some disease such as diabetes and cardiovascular disease. Ecuador became the first country in Latin America to mandate a label in the form of a traffic light using past surveys which indicate that more than 25% of the young population was overweight. The regulation applied to all packaged food and drinks, and the main objective of this strategy was to provide interpretive labels that are clear, precise, and non-deceptive, and permit the consumer to select food with a clear understanding of their nutritional content. Now let's talk about Argentina. The consumption of the industrial trans fatty acids had a significant harmful effect on cardiovascular health and increases the risk for a coronary event. It's necessary to modify the consumption of food high with trans fatty acids in childhood to prevent cardiovascular disease in the future. So policies that require removing industrial trans fatty acids and replaces them with polyunsaturated fats exist in Argentina, Chile, Brazil, Costa Rica, India, and Mexico. In 2008, the Argentinian government initiated a mandatory regulation that specified trans fatty acids in food should not exceed 2% of total fat in vegetable oils. Right now, it's not just about the 2% of the ingredients in the food. Right now, it's talking that there is no reason to have trans fatty acid in food. Probably in the next year, we will see that the trans fatty acid is simply out of the market for the good and the health of everyone. Okay guys, so that's everything for today. With this video, I just wanted to show you how the scientific evidence and the government policies can work together in order to improve our health and educate how to make better choices for the food and how to improve the quality of life. In the case of the childhood, it's important to prevent the overweight pandemic and the obesity pandemic to have a better generation and a better future for everyone. And remember that education is one of the better keys to improve our quality life. Thank you so much. Have fun.